Whoops, let me get my microphone to the right spot here. Hi, everyone. Hi, Alice. Good to see some friendly faces. Hi, Maggie. Some of you are a little more familiar with rheumatoid arthritis and these diseases. You might have had it for a little while, but some of you might be newly diagnosed. So wherever you are coming in from and whatever your experience is, hi Becky, of arthritis, I'm happy to welcome you to this webinar today. If you would like in the chat, let me know where you're zooming in from. I'm in Seattle, Washington, the West Coast. It's actually really sunny today, so everyone in Seattle is excited about that. And I am recording this, but just to let you know for your own comfort, it is being recorded in active speaker mode, which just means that since I'm the one talking, it'll mostly be me being recorded. However, if you do raise your hand and have a question and you're on video, you will be recorded, but you can request to not be recorded. Does that make sense? So you will not be recorded unless you ask a question and you would like to be recorded. So I can pause the recording at any time. And Alice is in Minneapolis, Juliana's Corpus Christi, Becky Hidden Valley Lake, nice. And Destiny, Southern California, awesome. Welcome everyone again. And yeah, this is actually, I'm calling this, it is a webinar, but the way it's set up in Zoom is it's actually set up like a meeting. So you are all in control of your own like ability to mute and unmute. So I just ask really quickly for like a housekeeping that you mute yourself unless you're talking, just to cut down on background noise. So for those of you who might have attended one of my webinars before, I always have a lot of slides and a lot to say, and I talk really fast. So I'm going to go ahead and get started. Hi, Chris. Hi, Katie from Morro Bay. Awesome. I can never remember where different cities in California are. Okay, and yeah, we're waving. We're all waving to each other from around the country and around the globe. And I'm also waving to those who might be watching the recording later. So I'm going to share my screen, and I will send you a link to a PDF download of these slides after the record or after this meeting today, so that you can have them for your reference. There are some like hyperlinks and resources for you. And I know some of you already in the chat, and you're welcome to add additional thoughts and resources as we go along. So I'm just going to go ahead and share my screen. And I will, there'll be times when I ask for if there are questions. Otherwise, I'll have you hold your questions to the end, just because I might be, answer your question, if that makes sense, in the course of this. So this is the welcome to rheumatoid arthritis, kind of asterisks and related other conditions like ankylosing spondylitis and psoriatic arthritis. Webinar and tips. I'm going to be giving you some tips for navigating your new normal. So you are in the right place if you have rheumatoid arthritis or a similar condition and maybe are feeling confused and overwhelmed, like not sure how to handle everything. And maybe you were given, I'm actually curious, I must already stop myself sharing. Raise your hand, either your little digital hand by saying react, or raise your physical hand if you were given a pamphlet when you were diagnosed. I've heard of this infamous the pamphlet. Okay, so some people are given the pamphlet, some aren't. Okay, I'm on like a quest to figure out what this pamphlet is. I think it's like a just little informational pamphlet, which honestly is better than nothing. But most people, the reason I do this webinar, kind of jumping ahead, is that I think many people need a little bit more / a lot more support and information when they're diagnosed than like one little 8x11 pamphlet. So this is also, you're in the right place if you're feeling a little lost and alone and overwhelmed. So even just in the course of this 1 hour, hopefully just through hearing from other people, from me and other people in this webinar, you will actually start to feel a little bit less alone. Because there's one thing to join kind of asynchronous online groups like Facebook groups and stuff, which is great. It can be such a lifeline, but it's another thing to actually be able to connect in real time. So welcome, Deborah and Melissa, who just joined us. So our agenda today, I'm going to be going really quickly over some like rheumatoid arthritis and arthritis 101 tidbits of information just to ground ourselves and make sure we understand the basics. And then I'll be sharing some tips for navigating your new normal and additional resources. So stay till the end for a special bonus only for people who registered for the webinar. Wee! And hi, Riley. It's good to see some familiar faces or some people I know from who are already signed up for the Room to Thrive upcoming program. So again, you can find my story online, so I won't belabor it too much, but just in case you're like, some friend told me about this random friendly arthritis lady who's going to be teaching a class on arthritis today. My name's Cheryl Crow. I'm the arthritis Cheryl Crow, not the singer, sorry. And I was diagnosed with rheumatoid arthritis now 22 years ago, actually, now that we're in 2025. I was diagnosed in 2003 at age 21. I've also been an occupational therapist for many years at this point, and I'm a mom and a wife. I'm also a dog mom. And I host the Arthritis Life podcast, and I created the Room to Thrive support group. And my favorite thing is to welcome newly diagnosed people into this kind of new culture, for lack of a better word, of having inflammatory arthritis. It is kind of like learning a new language, and learning new kind of customs, for lack of a better word, and this new way of life. So Carol, nice to see you too. It's nice to see someone I've met. I met Carol at the rheumatology conference. It's fun to see people I've actually met in real life. Chris Fish was there too. So this topic today is going to fit into this roadmap that I've created called Room to Thrive. We're going to be talking a little bit about the physical tools and the mental tools today. Those are two of the things we're going to cover. So first of all, why is it hard? I think something I noticed through helping a lot of people with arthritis over the last at least 5 years in particular is that most people feel like they're the only one who's struggling. So if you feel that way, please know you are not alone. Actually, the majority of people feel very overwhelmed after getting diagnosed with something like this. And the reason is, again, you might be anxious Googling, and trying to figure out what are the likelihoods that you're going to get better, what's the deal with all these medications and stuff. You might also just be weighed down by all the unknowns and potentially social effects, feeling alienated from friends and family. I'm curious if you would like to put in the chat, no pressure at all, what are some of the things that are the most difficult, quote unquote, pain points for you all right now? It's good for me to know so I could maybe try to interweave some ideas in this webinar. So a few other reasons it might be hard to, or is hard to adjust. Sometimes there's lack of clarity from your medical team, like what are your next steps, or when are you supposed to just not talk to them for 3 months between appointments? Like, how does that all work? And it's confusing medical jargon. People are using acronyms. Like when I say RA, by the way, it stands for rheumatoid arthritis. And, you might not know when people talk about what's a flare-up, what's remission, what's a DMARD, disease-modifying anti-rheumatic drug. There's just a lot to learn. Oh yeah, Riley, I mean, like what are your, pain points, I meant that metaphorically, but also it could be physically. Like what are some of the things that are hardest to cope with right now? And there's just a big learning curve, like no one tells you how to be a patient, right? And I just want to also recognize, before even going any further, that very many people, unfortunately, with autoimmune conditions like inflammatory forms of arthritis, like rheumatoid arthritis, have experienced medical trauma. By that, I don't necessarily mean physical trauma, like being in a car accident or that kind of thing. I mean more like you maybe being medically gaslit or told that you're not sick, you're just anxious, nothing's wrong with you. And that can be psychologically very traumatic. Yeah, Jordan, the fatigue is hardest for you because you're a busy person and like to keep a busy social life. Yeah, that's a great, or not great. I mean, I'm sorry that you're experiencing that, but that's a good example of the impact. The fatigue isn't just hard physically, it's hard because it affects your social life. So we will be talking a little about that. So I just talked about a whole bunch of things. Okay, well, other than fatigue, before I mentioned fatigue, what's interesting is there's so many things that are difficult, right, about this diagnosis before we even get to the actual physical symptoms. Like, so just again, taking a minute to recognize what you've all been through just through having to adapt to this before we even get to the symptoms. So now we do have the symptoms, the pain, different kinds of pain, different patterns of pain, like morning stiffness and fatigue, as well. And then other extra articular symptoms that are not in your joints, things like maybe lung issues, heart issues, or eye issues that can accompany RA. So yeah, and working your job, going back to school, Juliana, that is definitely a big one. And then Chris, yeah, difficulty planning for the future, and then brain fog as well. Yeah. Metaphorically, finding daily life hacks to work around the flares. Yeah, we will be talking about all that stuff. So just know, again, you've already seen in the chat if you are attending this meeting live. But I just actually have one of these quotes that reminded me of what Jordan, what you said earlier. This person said, I've always been a super high energy, do it all, take care of everyone else sort of person. It makes me sad to not be able to serve others in the way I have before. And it's hard to ask for help instead of being the help. If you're, does anyone relate to that? You can put a little heart in the chat if you relate to that. It's hard to go from being the helper to somebody who needs help, especially in the US where we have more of like an individualist culture. So here are just some examples from other patients. So, this is a little peek into my own psychology, but what I want to do, what I would like to do in this webinar, if I had a magic wand, is to tell you it's all going to get better. I have the magic thing that's going to make it all better. Unfortunately, I won't tell you that because it doesn't exist at this point. The minute there is a cure or anything like that, I will be the first to adopt it and let you all know. But I can't tell you for sure that it will get better, but I can tell you that, 99% chance, 99.9% chance you can and will get better at living fully with the ups and downs. It does become easier over time, even though your condition itself might not get better. So it's like Jatel, who I know is in here for a second, she and I have, I don't know if she's having connectivity issues, but she and I have this long-standing conversation about, knowledge is power, but ignorance is bliss. So again, I'm not willing to lie to you and say that for every single person, everything gets better, but you will get better at coping with whatever life is throwing at you regarding your health. I wanted to tell you, I wish I could tell you that if you just try hard enough and you find the right person to listen to, that you will be able to, without a doubt, control all of your symptoms. I wish I could say that. Unfortunately, I cannot say that because it's not true. There are parts of our health that are just out of our control. And there's going to be times when you do everything right and do every tool in your toolbox, and you still have some amount of lingering symptoms. But I will tell you that you can and you will get better at controlling what you are able to control. There are some symptoms that will be under your control. And then working around, like some people said earlier in the chat, finding workarounds to what you can't fix. So again, I guess I'm spending a lot of time normalizing, but before I jump into the more educational tidbits, remind yourself, deep breath. It is a roller coaster. It's not a lone roller coaster. There are others going through it too, and it does get easier over time. You will get better at differentiating between what you can and can't control and coping with this, what I think is annoying gray area, your zone of confusion or uncertain degrees of control, meaning it's not totally clear whether you can or can't control. Again, I'm going to give you all copies of these slides so you can look over them and take a little longer with them. But for sake of time, I'm going to move on. So let's do a quick rheumatoid arthritis and arthritis in general 101 crash course on the topic of knowledge is power. So what does the word arthritis mean? Arthritis just means joint inflammation. So arthro is joint, the space between the bones, for lack of a better word. Itis is inflammation. And so this is just an extremely oversimplified version of a joint. And then I want to make sure you understand that there are actually over 100 different conditions that fall under the umbrella of arthritis. Arthritis itself is not actually just the word arthritis is not a diagnosis, it's a symptom. Joint inflammation is a symptom of over 100 different conditions. This is where we're getting a little bit into like semantics, but rheumatoid arthritis is one of the autoimmune or autoinflammatory types. The most common form overall is osteoarthritis of all kinds of arthritis. So I like to lump this is something I created this chart with these different creaky joints and rheumatology.org fact checking mechanisms here, and other people have created their own charts, and I just wanted to see one that really clearly differentiated between like osteoarthritis and then the different kinds of autoimmune or immune mediated arthritis. So I know some of you in this room, in this Zoom room, have the rheumatoid arthritis, which is what I have. Could be seropositive or seronegative. I can talk more about that later. Usually affects the distal joints like the fingers and toes and like wrists instead of like the axial spine. Now, spondyloarthritis is typically seronegative, and it usually it can affect the spine, but it can also affect your periphery, like in the example of psoriatic arthritis or IBD, irritable bowel disease associated spondyloarthritis. So there's all different kinds of classifications, but just I'm the kind of person I have to see the big picture. And yeah, Carol, yeah, mass or mixed connective tissue disease is also, yeah, do I need to put that in there or is it in there? Yeah, this is, again, there's no way to have one chart that's completely perfect. So I should put this maybe under the other diseases, under like Behet, Stills, Sjogren's, scleroderma, and lupus. So there's also septic arthritis. So there's kind of the three that it's caused by the immune system, it's caused by degeneration or injury or potentially other factors, or it's caused from a life-threatening infection. So in rheumatoid arthritis, I like to conceptualize it. This is just how my brain works. In terms of, instead of this like depressing, like, I mean, I'm not happy about it, but I like to think about it as these immune cells that are very excitable and misguided that are accidentally attacking my synovial lining of my joints, which is that really slippery fluid that makes your joints move, or that allows your joints to move, that allows the bones to move smoothly. And they accidentally are attacking those previously healthy tissues. And they're like, my friend Dr. Karawada, she's an allergist immunologist who lives with Sjogren's. She likes to call them misbehaving immune systems. So it's kind of like you think about your immune system as like a little toddler instead of like this horrible, like my body's attacking myself. I like to think about it as my body's doing the best it can. It's just making a little mistake that causes a lot of other bigger problems. So over time, that causes inflammation, swelling, redness if you're Caucasian, tenderness, and then that can lead to the bone and cartilage and everything around it kind of becoming degraded over time, and joint erosions and stuff like that. But a lot of times people just stop there and they just tell you about that's arthritis, but that's what's happening in the joints also, because it is a systemic condition. There are these non-joint or extra articular symptoms, things like lack of energy or fatigue. I should put brain fog in there too, fever, sweating, poor appetite or weight loss, dry eyes, heart and lung problems, and then concurrent mental health challenges. So yeah, and Riley, I'm so glad to know that the toddler analogy helped you so much with that shift. Yeah, and it's not about toxic positivity. It's just about a small reframing of, in choosing to see your immune system with a little more like compassion. And that's not to say that we all shouldn't be able to have our moments of validating, like, I feel angry at myself. I feel angry at my body for revolting against me, but I just find it's a more compassionate way to live. So couple quick things about, like, again, if you're newly diagnosed, understanding some common terminology before we go to like the tools in the toolbox. A flare-up is a period of time where you feel worse. Now, the devil's in the details. There are entities that have their own definitions of a flare-up versus a remission. And remission is a period where you have no symptoms and your disease is not active, or asterisk there, very few to no. So some people consider low disease activity to be the same as remission. But just think of it as flare-up is a period of time when your joints and or your systemic symptoms are worse. And sometimes that's just a couple days, and sometimes that's a couple weeks or unfortunately, months. So remission is usually the goal. When you first get diagnosis, you're going to try to use what's normally the biggest tool in the toolbox for between, when you're with your conversations with your medical providers is medication. That's the gold. There are gold standard medications I'm going to talk about in a minute. But there are also, that as an occupational therapist, that's outside of my domain in terms of like, I can't ever advise people on what to do with medication, but I can explain to you as a patient educator the role, and as a patient, the role that medications play. And usually just long-term, let's set our expectations, even though hi Melissa, the goal is remission. The disease itself tends to be characterized by fluctuations between flare-ups and remissions. Honestly, that's like the number one thing I wish I had known when I was diagnosed. I kind of thought remission was just my end point, and that if I achieved it, quote unquote, I would stay there forever. I had no idea that you could be in remission and then you could flare up again and not be in remission anymore. And sometimes when I tell people that, and it's okay to feel scared or annoyed or frustrated or sad about that. Some people are like, you shouldn't tell people that's going to scare them and stuff. But I'm like, I would have lived my life differently when I had experienced remission for 6 years if I had known that that was temporary. I feel really strongly that you should know, like you should be informed, and then you can make your life choices, based on information rather than like what I felt in retrospect was false hope that my remission was going to last forever. Yeah, GT. Yeah, knowledge is power versus ignorance is bliss again, of 100%. So does rheumatoid arthritis and related diseases, do they tend to get worse, better, or stay the same? Technically, our rheumatoid arthritis is a progressive disease, which means that when it is not controlled by medication or medication in combination with lifestyle, it will get worse. That's the bad news. The good news is there are some very effective medications that extremely slow down that progression to the point where it won't necessarily progress very far in your lifetime, or they can stop the progression. But the not so good news is they don't always work for everyone. They work for the majority of people, depending on the study you look at. And around 80% is the one I see quoted the most often. And the good news is that there are more treatments than ever. I will tell you, I was diagnosed in 2003. There were only 3 medications in the biologic category back then. Now there are 9, plus all the biosimilars. So so let me tell you what those are. Okay, so really, really quick, because this is all stuff you can Google, but I just figured having an actual human like explaining it to you is helpful, people tell me. So there are 4 main types of medications for rheumatoid arthritis. So there's the ones that slow down the disease progression. That's one category. And the first 2 of those are disease-modifying anti-rheumatic drugs. That's things like methotrexate, sulfasalazine, leflutamide, hydroxychloroquine. Then there are biologic response modifiers or biologic DMARDs. Those are the expensive ones. Those are the ones your insurance wants you to jump through 900 hoops to get, and they cost thousands of dollars. I've been on biologics plus a methotrexate for the full amount of my 22 years living with RA, except for when I was pregnant or trying to get pregnant. And so those actually slow down the progression. Those are the first two kinds of drugs. The other 2 are for symptom management. So that's non-steroidal anti-inflammatories, NSAIDs, things like ibuprofen or naproxen. They don't actually slow the disease down. They stop the inflammation that's already started, but they're not going to stop it from starting. Does that make sense? Sorry, they stop it. Yeah, they're not going to stop it from starting. The DMARDs and biologics stop the whole process from happening in the first place, ideally. But if your disease isn't well controlled with those, then you also might need the NSAIDs. And then there's actual steroids like prednisone, which you normally want to be on for only short periods of time. Again, doctors can explain that better to you. But just so you know, I like to think of things again in like broad categories. Those are like the 4 categories. Other thing is, if you're coming to me, like I had a one-on-one client a couple weeks ago come in and be pretty devastated and pretty, it is really scary when you look online and potentially get access to a lot of stories of people whose disease has not been well controlled for many, many, many years. It's really important if you're diagnosed in this current era, which is like the last 2 decades, which I'm guessing most of you have been. There were no methods to prevent or stop joint damage in RA between the 90s, until 1990, full stop. So anyone diagnosed before the 2000s, let's just say for sake of argument, they have a completely different prognosis than you or me or anyone diagnosed in the 2000s and onward. Now, current therapy, when they say therapy, they mean medications, are such that progression from symptom onset to significant disability is now no longer inevitable, and RA patients can anticipate comfortable and productive lives. Okay. So that's the not just like I want you to think positive. This is actual like evidence-based information. Like more people are in remission than ever. So you really have to be careful if you're looking online for other patient stories that you're not comparing apples to oranges. Yeah, so Jordan, big diagnosed 2 weeks ago. I'm so glad you found this. I know it's going to be like drinking, water from a fire hose here, but just know that it is not progressing very fast for the majority of people. And if it does, because of the medications, if it does progress fast for you, though, it doesn't mean your life's over. We will figure out a way to cope with this. So this is my little graphic. I literally drew this, like my son had some program that I figured out how to like draw on the iPad. Remember that everyone who has the same diagnosis as you is a large category, and everyone on social media is a smaller category. They may not be representative of what you might experience. Yeah, and Riley has a family member, and I think if you have an older family member with your disease, it's particular can be hard because your mind latches on to that as an example. And again, not to say you shouldn't prepare yourself for like a worst case scenario, but really most of the people, you'll hear doctors say this over and over again, the majority of people with rheumatoid arthritis are living long, productive lives with these medications. Again, I'm sorry that it doesn't work. If they don't, medications aren't so simple and don't work perfectly for everyone. But the numbers are in your favor now more than ever. So, okay. So now let's get to a couple of things you can put in your toolbox and tips for navigating your new normal. So some of these tips are going to be mental, take care of your mind and getting support. And I'm going to give you some additional we call them practical tools. So first is conceptualize that you're going to be building a toolbox, like a symptom management toolbox. I know a friend, and I honestly still need to do this. I don't have one toolbox. I have various literal boxes and bins around my house. So you can build a physical toolbox. I'll show you one example. This is me being an occupational therapist and like a potential hoarder of arthritis gadgets. These are all my compression gloves. Oh my God. So many compression gloves. Well, now that I do social media, people start sending them to me too. But so compression gloves are one example, or even like wrist braces of a physical tool in your toolbox. I know some of you in this group, on this phone call, are wearing some as well. And sometimes it can just be like, it can be empowering to actually just gather whatever tools you have in one little place, right? So, oops, okay, so I jumped ahead already, but it's called building your toolbox is part of this overall category called self-management, which was funny. I remember when I very first was explaining this to one of the first groups that I ran, Jatel, who's in this group, and I don't think would mind me saying this because she shared it before too, is like, I don't like self-management. Does self-management mean like I'm all by myself? Like no one's going to help me? And in the world of like healthcare, self-management simply means like with a chronic condition that you're living with 24/7, you as the self with that condition are going to be managing it on a daily basis. So it behooves you to learn tools to cope with, the flare-ups and remissions and stuff like that. Oh, Riley, the iMac, she's asking the recommendations for smaller size compression gloves. The iMac ones, small ones, are the tightest, it's like smallest ones. I have small fingers too. So that's that brand, iMac brand. I'll just throw that in there. So, you know, I would love to hear from everyone else in the group what some of your best pain and fatigue tools are in your toolbox. But there are so many out there. There's hot and cold packs. You can actually, just put rice into a sock and heat it up in your microwave. It doesn't have to be, you don't have to go buy like a fancy hot pack online, or you could put literal ice cubes into like a Ziploc and use that as a cold pack. Using gadgets and tools that protect your joints, like this is a pair of like ergonomic arthritis friendly loop scissors where you can kind of hold them like this instead of having to use your thumb if your thumb is sore. And then I want to talk about fatigue because a few people mentioned it already. Fatigue is something that it's easier to prevent than it is to reduce. Same with pain, but really true for fatigue. So pacing yourself, thinking the luxury of kind of just winging it through your life is a little bit over when your disease is not well controlled, when you're having active, symptoms. So pacing yourself and planning ahead. I like to try to plan for like 80% of what I think I'll be able to do in a day so that I give myself some buffer. Ideally, you would have some control over your schedule so you can accommodate that. And then, yeah, okay, Katie's saying in the chat, heat is your best friend. People tend to be like either like they love heat or some people love cold. Some people are like, I'm going in a cold plunge every day. It really is. I should have put this in here, but it's really you're going to become a detective and like an experimenter in your own life and try different things, like throwing spaghetti and at the wall and seeing what sticks. And it's overwhelming at first, but over time you'll start to learn your body's patterns and what works for your body. And then other people like both. You're right, Giselle, like both, switching back and forth between hot and cold. I like the general rule of thumb, like in occupational therapy school that we learned was like if you do the opposite of what your joints are. So if your joints are warm, tender, and hot, then you're going to put ice on them. Typically, that would be the recommendation. But when they're like cold and stiff, like first thing in the morning, then applying heat will help mechanically just loosen up those tissues. So yeah, fatigue. So, okay, I'm going to say the most. So, another thing I should warn you all, the brand new diagnosed people, is that there's a lot of paradoxes in inflammatory arthritis, and one of them is like, so for fatigue, there is a European League Against Rheumatism like evidence-based guideline for fatigue, and there's one is like step one is like make sure you're on the best medications for you, and sometimes that means switching up your medication plan. Sometimes doctors will like to rule out a sleep disorder because people with rheumatoid arthritis are more likely than the average person to have an undiagnosed sleep disorder like sleep apnea, even in the absence of any other risk factors. And then the third is some will actually give stimulants like ADHD type medication for fatigue. But in terms of lifestyle interventions, like this is the paradox. The strongest evidence of any lifestyle intervention for fatigue for people with arthritis is exercise. And why am I saying that's a paradox? Because you have to expend energy when you're fatigued. It doesn't make sense, but yet it does. No, it makes sense because, first of all, exercise when it is at the just right level for you, which usually means I try to think of exercise as like the most simple way possible is like whatever you're currently doing, physical activity wise in a day. Don't even use the word exercise, just physical activity. Do a little bit more. Just do a little bit more each day, a little bit, if you can. So if you walk up and down your stairs twice a day, can you walk up and down your stairs 3 times a day? Or if you're, take a walk to your mailbox, can you go past to the next person's mailbox and come back? Like start really small. And then I was shocked honestly because I always thought the benefits of exercise were from cardio, but when I started doing strength training a year and a half ago, those of you who know me better have heard this too many times, but I noticed a distinct improvement in fatigue when I started strength training specifically. So I found that people tend to be, sometimes you feel worse after you exercise. That's the other kicker. So you have to figure out, again, for your body, some people, if they strength train, they're not as likely to get fatigued afterwards as if they do cardio or vice versa. So picking one type of exercise and starting slow is the biggest evidence in the field. Again, it's frustrating to have to deal with these weird like unintuitive things, but that is like what that is autoimmune in a nutshell. It's like unintuitive. So you might have been told your whole life, oh, listen to your body. Like when your body says to rest, you should rest. It's not quite so simple because your body might be telling you to rest or telling you not to move because you have pain. But actually, it's not only evidence-based for fatigue, also evidence-based for pain, exercise interventions. So you can also get help if you're overwhelmed from a physical therapist. Hopefully, you can find one or occupational therapist with training in people with inflammatory arthritis. There's also, basic healthy habits or helpful habits, like other than exercise, sleep, Prioritizing sleep is huge. Fatigue is different than lack of sleep, but still adequate sleep helps exacerbate or helps prevent additional fatigue because lack of sleep can exacerbate fatigue. Um, yeah, yeah. Oh, interesting. Jordan said that her doctor said, or his doctor said that when your immune system does the opposite, when they're exercising, that it stops attacking your own body. That's really interesting. So that could be a good mechanism for why it works. You also, there are social tools, mental health tools, which we're going to talk about. And I mentioned earlier being a little detective in your own life with arthritis, learning how to track your symptoms. I think one of the most confusing areas for newly diagnosed patients is this whole idea of which lifestyle or integrative health interventions are going to be give me the most bang for your buck. I mean, I hate to be broken record, but it really is exercise. And this is informed by like a 500-page PDF that you can download from this site. I'm happy to give you a copy of it, but the American College of Rheumatology, recommends exercise more than any other for people with rheumatoid arthritis. And actually they're against any formally defined diet other than Mediterranean style for a number of reasons. So Maggie's listening to this on a walk. Awesome. Okay, so I also have, I know there's like a very, 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 very fast overview of building your flare-up toolbox or your pain and fatigue toolbox. I do have another full training, like a full hour on building your flare-up toolkit, which goes into more depths, and that's free. It's just on YouTube. So this is, again, I'm going to send you the link to all these. Actually, let me stop sharing now so I can just give you the link now so that you don't have to worry about it later. And so that you can have that flare-up toolkit training. So I have a lot of, it's this other paradox of like, I want to give you all the information, but I also know that like when you're overwhelmed, then it's difficult to have to synthesize so much information. So I'm trying to find a nice balance here. So, okay. Helpful habits you might start. Again, I mentioned, low impact, exercise, maybe nutrition, and overall anti-inflammatory eating pattern, and then prioritizing sleep and rest, and then a little bit of mindfulness. We're going to talk about that more later. You can also use little joint protection gadgets in your daily life, like a jar opener, and mentioned earlier, modalities like ice or heat. And another not as exciting but important fatigue intervention is delegation. So delegating tasks. That's my favorite one. Telling my husband or my son to do the things I don't that are going to take me too much energy. Don't feel bad asking for help, okay? I know I can't police your emotions, but try not to. Step 2 is just getting organized. Again, when you feel overwhelmed, it could be because you have too much information in a short amount of time. And I think getting organized can help you minimize that sense of overwhelm. And so I do have this master checklist. And I'm going to send you all a link to this master checklist, which is like what you can go through one at a time, step by step, to start feeling a little bit more like you have a handle on your new normal of having a form of inflammatory arthritis like rheumatoid arthritis. Janelle, great idea when it comes to asking for help or delegating. You know how good it feels when you're able to help someone else out. Why are you denying that feeling to someone else? Oh yeah, and Maggie, you have a cheap walking pad you can use while watching TV. That's a great idea. Safety wise, you do definitely want to set it up so you're not going to be tempted to fall off of it, because that can be a tripping and falling hazard. Another thing when it comes to getting organized is understanding, this is really, really important. Your team, your care team is not just you and your rheumatologist. There are so many other health providers that can help you. Starting with maybe in your rheumatologist office, there's the nurse, the rheumatology nurse. There are social workers, counselors, occupational therapists. Obviously, I'm not biased as I am an occupational therapist, but a lot of times we're forgotten. People don't think of us until someone's really, really, really affected by the RA and like needs surgery for joint replacements. But we can help a lot earlier in the process. Same with PTs, registered dietitians. I was shocked when I started going to a dietitian to get some support. My copay was $0. I don't have any other provider where I don't have a copay. For some reason, for nutrition, it was $0. So that was like, I'm just saying, I just needed to emphasize that, just take myself off of the little screen. And the pharmacist and the specialty pharmacy where you might be getting your medications can be a huge resource to you as well. And then psychiatrist or psychologist, finding someone that has experience with chronic illness can be so helpful. Speaking of that, so there are things you can do to take care of your mind because it is a very stressful process to get diagnosed with something like rheumatoid arthritis. So here are some of the things that I find the most helpful. Oh my gosh, I forgot to put my meme in there. Sorry, I just realized that. I'm really bad. Those of you who've known me before, I always like tweak things at the last minute. So I was tweaking this like literally 10 minutes ago because I was like, oh, I want to add this, I want to add that, but I forgot to add the humor. But anyway, I'll direct you to some humor. But start with mindfulness. Okay, so you might be annoyed at hearing this again. Everyone's like, you just need to practice mindfulness and you're going to feel better. But truly, it has been extremely helpful for me and many people that I've worked with in the rheumatoid arthritis community. And it's not about feeling peaceful. It's not about feeling relaxed. Mindfulness is about feeling whatever it is you're feeling in the present moment. So keeping your attention in the present moment without judging it as happy or sad, good or bad. That's one of my favorite definitions of it. So being able to be present without judgment or trying to change what you're feeling. So why do I like it? Especially when you're newly diagnosed, because a lot of times you're overwhelmed and your anxiety and stress is from all the things that could happen, whether or not they're legit, whether or not your worries are legit. It's true. A lot of bad things could happen, but if you get wrapped up in those future worries, you're never going to have time to actually live your life. So the mindfulness redirects your focus to, okay, what's happening right now? My own therapist, I'll just give you some life pointers that she gave me. She's like, I know it feels like your worries are protecting you, but actually nothing. Like, she's like, can you think in your life of an example where the fact that you worried about something made it either not happen or made it like easier when it happened? I was like, good point. Yeah. So just being able to be comfortable with the present moment is huge. And then the second thing, some of you have heard me say this before, especially on the podcast, acceptance and commitment therapy, ACT. I think the 3-step process is so powerful. It's accepting your thoughts and feelings. That doesn't mean you like them. It just means that you're allowing them. So the A could be more like allow, like taking a moment to connect with them, be present with your thoughts and feelings. Then C, connect with your values, and T is taking action. So it's a big mind shift, but you make room for your feelings and allow them to be exactly as they are. Then you ask, what can I do right now that's truly meaningful and important? And instead of asking, how can I feel better? That's a huge shift, and it's really, really helpful. And yet, Carol, journaling is also extremely helpful. Thank you for sharing that. And along with acceptance, I think self-compassion is it's a powerhouse. ACT plus self-compassion. And self-compassion simply is giving yourself the same kindness you would give to a good friend, right? So a lot of times, like, how many of you have accidentally self-gaslit yourself, saying, well, I shouldn't feel bad because I have arthritis, or I shouldn't feel bad that I have arthritis because other people have it worse. Yeah. So there's more than one person in the world gets to feel bad, okay? Like literally, because if you take that to its logical conclusion, like only one person gets to feel bad. That's not cool. Like suffering is relative, right? You deserve to feel whatever your feelings are. Our goal is just not to get stuck in our feelings and to actually be able to move on from the feelings of, anger and grief and move towards like effective action. So our values-based action, that's kind of the goal of ACT. So the 3 elements of self-compassion are self-kindness versus self-judgment. So giving yourself that validation, like, this is hard for me right now. How can I connect and comfort and care for myself in this moment? And then also connecting to your common humanity. Suffering is a universal part of human existence. Even you think of as the most peaceful person in the world, meditating on a mountain, they've still had experienced suffering too. And then mindfulness versus over identification. That's like at a glance. So again, back to ACT, because I know it takes a minute to sink in. Why would I want to accept bad thoughts or feelings like sadness or anger, right? Why is Cheryl telling you to consider the possibility of accepting or allowing uncomfortable feelings, thoughts, and emotions. Now, in ACT, this is my favorite, frame of reference for mental coping with rheumatic disease. The main interest in the thought is not whether it's true or false, but whether it's helpful. If we pay attention to this thought, will it help us create the life we want? So it is what it is, in other words. What I love about ACT is before I used to think, okay, I'm just gonna like figure out a way to control my emotions so I only feel the good ones and then I don't feel the bad ones. Has anyone else ever tried that? We're like, I feel bad. And this is what we do to children. I really saw this as a mom. My son's 10 now, but we say, oh, you feel bad. Oh, no, 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 take a deep breath, feel better, feel better. Like we tell people from a young age that they're supposed to only feel good all the time. But it's like the only way out is through. Like nobody feels great all the time. You're actually causing further suffering to yourself by trying to force yourself to try to see, like try to be happy with something that's a fundamentally unhappy situation. The better way out of that is just to be like, yeah, this sucks. I'm going to allow myself to feel this feeling, and then I'm going to turn my attention towards what is still possible in my life with this feeling, with this discomfort, with the fact, the uncertainty of I don't know if it's going to get better. That's one of my common ones. I don't know whether I'm going to be better or worse in the future. I don't know if my condition's going to get better or worse. And I hate that. I want someone to give me the crystal ball and tell me, but they're not going to. So I could say, okay, this is what it is. I'm carrying that discomfort. I'm carrying that stress and anxiety. I'm not trying to make it go away. I'm saying, yep, there you are. You're coming with me, but I'm turning like physically. I imagine my head like physically turning towards these are just part of my life now. And I have to move on to say, what can I do? What can I do with this crap, with the fatigue or with the pain, so I really, really encourage you, if nothing else from this talk, if you're newly diagnosed, understand that you're going to have choices of where to put your limited energy. The majority of patients when they're newly diagnosed put all their energy here into trying to make it go away, trying to cure it or heal it, which again, it's not that those are always a bad idea. Obviously, medication that can put your disease into remission, which is the most likely thing that was going to put it in remission, is important. But if you exclusively only focus on this, you're going to miss out on opportunities to adapt to this, to see it folded into your life and understand that this is probably some degree of pain or fatigue are going to be in my future, whether I go into remission for a period of time or not. So can I live a good life along with this? That's kind of the big goal. So, uncertainty is my biggest trigger for stress when living with rheumatic disease. And so you kind of have choices. You could either like door number one is like the positive thinking. It's going to get better. I just need to figure it out. Door number 3 is the opposite of that, like the doom and gloom. Like it's never going to get better. And those of you who, if you're in this, training, that you're likely in either 1 or 2, because why would you spend an hour listening to someone talk about this if you didn't think there was any possibility of it getting, potentially better in the future? But then door number 2, this is the one that is my like kind of life work, is trying to figure out how to live here, because understanding it might get better, it might get worse. I don't know. Like being comfortable with the unknown is the way. Like that is the sustainable path in my experience and the experience of people in my groups. Obviously, if you feel different, let me know, because I'm always up for a healthy, respectful debate. And yeah, Riley, they're not bad. They're neutral and a natural part of our emotions. And the stress of ignoring your emotions and trying to force yourself to think a different way than you do is, can actually cause flares. So this is probably too much for right now, but just know that, the old pattern for me was to try to fix everything and distract and avoid discomfort. The new pattern, the more sustainable pattern, is to allow whatever I'm feeling expand and let it be, even if it's uncomfortable, and then turn my attention towards what's possible rather than making my whole life about controlling my symptoms. Another way of conceptualizing this in ACT is called the choice point, where you have an option to turn towards a life. In this case, I would conceptualize that as a life with your condition, with rheumatoid arthritis, and say, okay, can I adapt? Can I alter? It's not saying I need to go back to my old normal, and I need to go back to my old life. It's saying this is a new normal, right? This is where that phrase comes from in my head, at least. What can I still love and do with arthritis? Oh, no worries, Destiny. Goodbye. Yeah, if you need to go, that's totally fine. Denial is a great short-term strategy for avoiding feeling your feelings, but you know, they're going to come back at some point. You're going to have to contend that this is happening. I'm sorry to say, if you have, this is like the tough love. If you've gotten this diagnosis, you, your life is going to include this condition, whether, unless there's a cure, this is happening. So sometimes we just need someone to like literally like hit us over the head with it. Like you get the life with rheumatoid arthritis. You don't get the life without it. And we can definitely throw an anger party about that. I have done it many times. Why did this happen to me? And that's again very valid to feel your feelings, but we just don't want to get stuck there forever or try to convince ourselves that maybe, I mean, now devil's always in the details. Again, maybe you did get misdiagnosed. Unfortunately, that does happen, but most likely you have some sort of health condition if you're here. So accepting it is going to be the way. So the next thing is not to do toxic positivity, but to experience moments of gratitude just for saying, is there something that we can do or acknowledge about the situation that we are still grateful for? That is a very, very helpful process. I'm sorry if some of these slides are cutting off, by the way. I don't know why. From my life, an example would be like, I always thought we were going to have multiple kids, like in my head, like a family. It was totally one of those health privilege things, but family is just kids. Like, because I grew up in middle child of three. My husband was middle child of three. We're going to have kids. We never said we're going to have kid, but we ended up, we had one child and my health issues got a lot worse. And we just ultimately decided not to pursue and having another child. And for the rest of my life, there'll be some part of me that feels that loss of, the future that we envisioned for ourselves. But also, I can feel grateful that I have one child. And if it wasn't for Charlie, my child, I wouldn't have gotten Teddy, my dog child. And so I also allow myself to just feel both of those feelings at the same time. So last tip, oh my God, sorry, I really need to go faster. Getting support is good. Getting support is okay. Other second thing I wish I had done is get therapy earlier. I didn't go to therapy till my son was 1 year old, and I had already been living with RA for over 11 years at that point, and I was just toughing it out on my own. So there's so many different kinds of support. There's group versus individual, in person versus online. There are groups that are specific to your diagnosis. There are also just general chronic illness groups. And they can be facilitated by other patients or lay people or professionals. The Arthritis Foundation has a great one, like Connect groups that some of them meet in person in your local like neighborhood area. I have my own virtual program I'm going to tell you a little bit more about. So, we'll take a second to breathe. Remember that feelings are for feeling. I zoomed way out to like mental health, and then we're going to zoom back into some more specific. So the recap is that, you can build a toolbox. There are things you can do in your daily life, like hot therapy, cold therapy, using life hack gadgets around the house, and using, getting organized is going to help you feel more empowered. And then taking care of your mind is going to help you experience this new way of life with more ease and more confidence. And just more peace, even if you are experiencing like discomfort. It's weird to think, but you can be at peace even when uncomfortable. I don't know how that works, but that's my goal a lot of times. So I did want to tell you a little bit about my program because we have, and then go to Q&As. By the way, I'm able to stay over like 15 minutes. So if people want to do longer Q&As, that's totally fine. But, unfortunately, too many people really are left on their own to try to figure out all of this, all the tools for their toolbox. So I have my own program that I created literally just because I just felt like people needed more information, evidence-based information and guidance and support. So it's a self-paced course called Room to Thrive, and then you can do it the course along with the group support. It's kind of an older picture, but some of the people are still in the groups, the alumni group now. And I created this framework to really walk you through. Thrive is actually Room to Thrive. Thrive is a acronym for like all of these tools for pain and fatigue, healthy habits, navigating relationships, your mental health, values, and then executive functions. That's like symptom tracking, advocating for yourself, all that good stuff. So this is the more detailed overview of the program. It's basically like an orientation. It's a comprehensive orientation. Like this is your new job, is having rheumatoid arthritis or a similar rheumatic disease. It applies to ankylosing spondylitis and psoriatic arthritis as well. And I have lots of wonderful testimonials that you can see on the website too. So I always like to let people know about this because it's all word of mouth marketing or social media. I don't have like a giant marketing technique or other than that, the podcast and social media of getting the word out about this. And oh, thank you, Becky. Yeah, Becky says it's a great program. She recommends it. And so here's a couple more testimonials. But I'm saying this because the next groups are starting next week. So they're cohorts. So you go through it with the same small group of people. It's up to 16 people in each group, and there's a few spots left in each group. And actually, no, I'm looking at my little post-it note system. There's actually like 7 spots left in the Monday group now, and 5 spots left in the Tuesday group. So there are a handful of spots left, and this is where you can go to sign up. I'll put that in the chat if you're interested, but don't sign up right yet because I do have a little, oops, I'm gonna stop share for a second so I can present. Why did it do that? Present, there we go. Okay, sorry. I don't know what I'm struggling with Zoom right now, but I do have a little coupon code for people who attended the webinar because you deserve some reward for sticking through this webinar. Oh, sorry, that is so, wow. Well, I don't know what happened to my color coding here. So if you use the code you want to sign up today, if you use the code web30, you get 30% off. That just goes from today till tomorrow, and it brings the price down. So I also do pay what you can options at all times because I want people to be able to get this program if they want it. And so, you can figure out a lot of this on your own, but it does take a lot of time and stress, and it's lonely to do it on your own. So that's why I offer like the support group. We meet weekly for 4 months. It's really it's fun. We laugh, we cry, we share memes, we talk about deep things, we talk about, everything. So I would love to answer questions if you have about that group, but also just general questions about rheumatoid arthritis. And I will be sending you a link to this replay. And I'll actually, if you would like to get in touch with me, I have a website, arthritis.theenthusiastic.life, or no, arthritis.theenthusiasticlife.com. And my email is here as well. So, well, Chris has a long comment. I'll read that in a second. But thank you all so much. If you do need to go, that's totally fine. I can stay extra for questions, and I can stop the recording if you would like your question to be off the record. Just let me know. So if you have a question or comment, you can feel free to raise your hand by going to react and then raise hand, or you can raise your physical hand or put your question into the chat. I'd be happy to answer. I could scroll up. I think the question about fatigue earlier, the only other thing I was going to say about fatigue, I'll just say one more thing because I want to make sure to give you this really great acronym. The SPACE symptoms, those are sleep, pain, affect, which is like emotions, cognition, and energy. Those symptoms interrelate when it comes to autoimmune conditions and rheumatoid arthritis specifically. So when we're talking about tools for fatigue, there's specific tools like, pacing yourself, conserving your energy, balancing activity and rest. But there's also the fact that your sleep levels, your emotional state are also going to be affecting your fatigue. So if you can, as my friend, Dr. Afton Hassett, who's wrote this fabulous book, I'm going to put a plug for her book because this is a great book, Chronic Pain Reset, evidence-based. She's a pain professor and researcher at University of Michigan. She she says, if you can turn the dial up on some of your other lifestyle interventions, like your emotional let's, for example, if you're really fatigued, practicing mindfulness and prioritizing sleep that night could actually turn the dial down on your fatigue. Does that make sense? So I really like that framework. It's evidence-based, and I kind of put in, along with energy, I kind of put exercise in my head, because I'm like, exercise can affect those other things. Exercise improves sleep, improves pain levels, and improves emotions. Typically, as long as it's done in that just right zone where you don't over exert yourself. I'm curious if any of you have experienced what's called post-exertional malaise, where you feel worse after activity. Yeah, that's really hard. And the evidence for post-exertional malaise is still to gradually increase your activity levels. It's just much, much more gradual than someone with rheumatoid arthritis who doesn't have, oops, I just gesticulated my compression gloves off my desk. That's okay. Then somebody, if you have just rheumatoid arthritis, like me, I don't have myalgic encephalomyelitis, or chronic fatigue syndrome, and I don't have post-exertional malaise unless I extremely overdo it. Like, I consider the post-exertional malaise for me is like on the level of just anyone else. Like, I once went on a 4-hour hike with my brother when he was visiting, and like the most activity I'd done before that was like 30 minutes. And I was like, yeah, like I felt horrible for the next like 2 days, but that was very like predictable. Um, and so for me, I was able to jump into a strength training program and escalate it pretty fast, but because I don't have that symptom. But if you have a post-exertional malaise, you would need to do it slower. But the recommendation is still to increase your window of tolerance for activity. If you don't, unfortunately, our muscles, there's the muscular part of fatigue, which is if you're not using your muscles, then they become weaker over time, and then it's harder to move because you don't have adequate support around your muscles, right? So there's that component, and there's like the metabolic component and things too. So sorry, I couldn't read the whole thing of Chris's, but yeah. Yeah, and Chris, you generally agree with door number 2, and the only part of door number 1 you still advocate for is what can we be absolutely certain of? Yeah, that's a really good point. Yeah, can you be certain that we have a capacity to give to others, reminding yourself of the things, the positive things that are fully in your control. Yeah, I really love that perspective. It reminds me of that Man's Search for Meaning book about by Viktor Frankl, who is like a Holocaust survivor and talked a lot about like a meaning-based life, even in like the most dire of circumstances. So I think that's a really beautiful point. Um, and to tell, you need to accept that this is just like chronic illnesses, your life, so are physical therapy and other supports you need. Oh my gosh, this is so true. You used to think that you would graduate from these therapies. Now you're grateful for these tools. Also resentful, to be honest, and still grateful. Yeah. And now yes. And now you're a Room to Thrive support group graduate. Yay. It's fun to see some of you. You're not tired of me yet. Some of the people who've done the program are in this group right now. Yes. Oh, Juliana, yay. I'm so glad you signed up. Awesome. Yeah, never. Any other questions? It's okay. Oh, Katie, okay. You hit on one of my favorite topics. Going to start methotrexate. Yay. Yes, so first question would be, are you signing up or are signing up? Are you doing injections or oral pills? You don't have to share, by the way. You do not have to share. Um, yes. Oral. Okay, great. So know that. Oh, and Jordan, you just started oral pills 2 weeks ago. And then Juliana. Oh, we have 3 newbies to methotrexate. Okay. So overall, just know in general, as a piece of information, that when a methotrexate is injected, it's associated with a less likelihood of GI upset or nausea. But that said, many people start with oral tablets just to see, because it's easier on them than an injection, and they would like to try to see if their body is fine and their stomach is fine with the oral tablets. So just because you take oral tablets does not mean you're going to get nauseous on it. Yeah, Rebecca, you've okay, Aaron started it in December, and then Rebecca's been on the pill since August. Wow. Yeah, and many people do well on it. It's the gold standard. If it's gonna have a side effect, it would be most likely to be nausea and or fatigue within the first day of taking it. Some people, and anyone else, please chime in the comments. Some people tend to feel the fatigue if they're going to have fatigue or nausea, they feel it right away. Some are more like 12 hours after they take it, and some are more like 24 hours after they take it. Those are just the categories I've noticed. So what's helpful in the beginning is to write down how you felt like right after, 12 hours after, and 24 hours after. Then if you end up saying, I get occasionally tired about 12 hours after. I think actually, yeah, I took mine last night. I'll probably get tired around tonight. So I try to take it at night because it's the next night that I will get tired and I can hopefully sleep it off. If you're more of the faster metabolizer, like it's only 12 hours after, then you might want to take it in the morning so it hits you at night. Does that make sense? So, yeah. And Maggie, you were able to sort of figure out when the side effects hit you most. Yep, exactly. Same wavelength. Yep. And yeah, and a great thing about methotrexate is that it helps your body not develop antibodies against the biologics that you take. So, and Erin, that's great to hear that your side effects have been mild and manageable. That's awesome. And yeah, mine's very manageable. Again, it's just very occasional fatigue. And I'm still, when I have a fatigue bout, I'm always kind of like, is it something I did? Or like, it's not like, there are some people I do know who are like, it's very noticeable. It's like within 12 hours of taking it, they feel very, very fatigued. So some people choose to start it on like a weekend so that to build in that window wiggle room so that if they do end up feeling fatigued or nauseous, they don't have to work during it. So, oh, and Aaron, that's great to hear. The side effects are lessening the longer you do it. Okay. Yes, and taking so if you end up if you do have nausea as a side effect and it's like to the point where you want to have something to help it, but you don't want to like it's not so bad that you want to go off of methotrexate, then yeah, taking anti-nausea meds ahead of time. That's a great point, Maggie. Yeah. Okay, symptom track. Oh, Katie, let us know any other questions about methotrexate, but um, it hopefully will work great for you. And I was actually really, when I reviewed some of the research, about 50% of people do well on methotrexate alone, like just methotrexate, which again, reminding myself that the people I tend to interface with and interact with are a population that is more complicated, more complex, right? Than and having like me having to take two medications or switch over time. So you might do well on just methotrexate. We have one person in the alumni group who's just on methotrexate. The majority in the support groups are maybe on multiple, depending on yeah when they got diagnosed and such. Chris is asking any favorite symptom tracker apps. You use the apps note. Yeah, notes app on the phone. That's what I do too. But and Jordan used iPhone Remind app. Yeah, Jatel has an awesome Google Doc. A lot of people have been telling me about Guava. Guava is apparently a really great one. Yeah, Maggie's like, I have to color code it like by hand. I do love doing things by hand. It synthesizes in my brain better. Um, so I'm going to put a little plug for Guava app because what's cool about the Guava app is that and it's free, is that oops, free Guava app. It syncs up to your medical record if you give it permission to, so that you could see your records and everything like that and your symptoms in one place, which is really powerful. Um, oh yeah, maybe some antihistamines, are also anti-nausea meds. Okay. And then Riley, not an app, but you use a journal. Okay, Jordan, yours gives you a notification every Wednesday to remind you to take your meds. Yeah, yeah. Nice. Anything else? Any other questions or comments, questions, criticisms? Riley, yeah, Riley, you a pre-filled journal book for symptoms. Is this the one that was like the stomach one? I think you mentioned in the okay. Awesome. Um, and yes, Jordy, the digestive health journal. Okay, that's Maggie's. Okay. Thank you all. I'm so glad, Erin, to hear that. That's really, I love hearing that. That's why I do this. I'm, this is a weird silver lining to the pandemic, but when I started Arthritis Life in 2019, I was thinking more of doing things in person in the Seattle area. And I often think to myself, gosh, like I'm really glad in that I got accustomed to doing things online during the pandemic because there's just so many more people that I could help and interface with, right? Um, so than just in the Seattle area. So thank you all. Um, yay, thank you so much. Oh, thank you. You all are all too nice. And as a Canadian, Erin, glad it was virtual. Yeah, yeah, yeah. And we had someone from Italy at one point. There's been one person from Japan in one of the groups, someone from South Africa, someone in Central America. Okay, yes, so Jordan, great question. If there's a night you can't attend, yes, so all of the sessions are recorded in Room to Thrive with the caveat that like if you would like to speak off, and I share them in the private portal just to the people in the groups, but some people are still like, because it is being uploaded to a separate website. So if you're uncomfortable with things being recorded, that's totally fine. If you have a question or want to, connect with the group without being recorded, you can request to just for me to pause the recording. It literally, yeah, and many people watch the meeting, yeah, meeting recordings afterwards. So, yeah, Maggie, you missed one of the sessions. It was okay. You caught up on the video. Yeah, and honestly, most people end up having to miss one or two just because hashtag chronic illness, like, getting sick, having to make an appointment, being too tired, falling asleep, it's totally okay. So, there's also an asynchronous right now. This is the last time we're going to be using still Facebook, but we do have like a bonus like Facebook group, a private group where we can connect. I'm going to go off of Facebook because there's too many ethical issues with Facebook. But for now, we still are using Facebook for the asynchronous connecting. So you'll have a chance to talk to the other people in the group through there as well. Yeah, super easy to work around and get caught up. Yeah, around Christmas time, it got for the last cohort, which was like started in September, there was a lot of people gone a few times because of people being sick or whatnot. So that's all okay. Anything else? It's perfect timing to start wrapping up because I got to get my son at school in a few minutes, but I do have time for one last one if there's anyone who's procrastinating on asking a question. Yes, thank you all so much. It's really nice to see your faces and to connect and take a breath. Yeah, and GT, you join people join the groups. Oh yeah, they join the meetings from bed. They join the meetings while cooking dinner. Sometimes we just life happens, and people just come however they can. So I'm so glad this was helpful. I know we had an occupational therapist or physiotherapist that was going to come as well, or maybe watch the replay. So thank you all for whatever group you represent, whether it's chronic illness or healthcare providers. This is all helpful information. So. Yep, Riley, this is a great point to end on. If you feel overwhelmed and feel like you can't take it for the next 5 minutes, it's too overwhelming, take it 10 seconds at a time. That's great advice. That's awesome advice. Thank you all so much. And I look forward to seeing those of you who are joining the new groups and those of you who are in the alumni ongoing group. I'll see you at our meeting on Friday. All right. Thank you all so much. Yeah, one moment at a time because one day is way too long. Hashtag yes. Yes. Thank you all so much. Bye bye for now.